morning, good afternoon, good evening. I'm Dr. Tanvir. I'm a practicing consultant at Tanvir Hospital, which is located in Hyderabad, India. I'm a gynecologist by profession, an OBGYN, and my area of interest or my area of practice is minimally invasive surgery. So I'm a certified endoscopic or hysteroscopic surgeon. I'm also a clinical fellow of urogynecology, and I've done my advanced training in minimally invasive surgery. I practice at Tanvir Hospital, where we have an Advance Gynecological Center. You can go and check the website Advance Gynecological Center for all the details. I practice with my senior, Dr. Meeta, who's also a practicing gynecologist and an obstetrician, and Dr. Akanshi, who's our obstetrician and a gynecologist. So we cater to women who have problems of abnormal uterine bleeding, of infertility, polycystic ovarian disease, menopause, and osteoporosis. We also cater to women who have urinary problems or pelvic organ prolapses. So my area of interest, as I've mentioned, is in these fields, and I also perform advanced ultrasounds. Recently, I have completed my training from Harvard in clinical research, and the reason for doing that is because clinical research, if done in the right manner, has very good clinical application to improve patient care. That is the main reason to perform research, and that's exactly what we believe in, to give the best to our women. Do you know about fibroids? What are fibroids? Fibroids are non-cancerous growths that come inside the uterus, and they are fibrous and muscular inside the muscle of the uterus, which are slow growing tumors. The risk of cancers are extremely low. They come in about 20% of childbearing age, and between the age of 30 and 50 years, almost 70 to 80% of women have uterine fibroids. So obesity is a major risk factor of fibroids. That's why there is an increase in the number of fibroids that we are finding in today's time, because obesity is a risk factor. And the reason being an increased level of estrogen inside the body, and that causes an increased growth of the uterine fibroids. Now next, let's talk about the symptoms. What are the symptoms? Many women are asymptomatic, but the symptoms occur in 1 in 3 women, and they can be severe. Menorrhagia means part of menstrual disturbance that occurs during their cycle. They have very heavy periods, just for about a day or two, but the periods are equivalent to like opening a tap. It's just like water flowing out. It's that heavy. The second can be pain, lower pain abdomen, during periods, severe menstrual cramps, back pain, which needs to be addressed, and infertility. Again, women cannot get pregnant at times because of the fibroids. A mass, a feeling of fullness in the lower abdomen, because fibroids can be the size of a small pea or a lemon or as big as a watermelon. They can be extremely big also. And they can be just one single fibroid, or sometimes multiple fibroids. The other symptom that can happen is a frequency to urinate. Also constipation if the fibroid is more towards the back of the uterus. That is difficulty in passing motion, and also difficulty in passing urine freely. Next is types of fibroid. What are the different kinds of fibroids that we come across? Now let me show you an image of what a fibroid looks like. This is a uterus, a uterine cavity inside, and this is the muscle, an outer layer of the uterus, and this is the muscle of the uterus. In the muscle, you come across round ball-like structures. These are called fibroids. Where can they be? One, they can be outside the uterus on the outer layer, they can be inside the muscle, or they can be inside the uterine cavity. Now, if they're outside the uterus, hanging on the outer layer of the uterus, many a time they're asymptomatic and they do not cause any trouble. Unless they're very huge, like a big football or a watermelon. The second are in the muscle. There are different places that can be present, a single or multiple fibroid. If they are more towards the outer wall of the uterus, usually, and they're small in size, they do not cause any trouble. But in the mid-body or which are closer to the uterine cavity can cause pain and bleeding. The fibroids which are inside the uterine cavity do cause problems, as in heavy periods, and they also cause pain, discomfort, and infertility. That is, chances of getting pregnant definitely falls down. How much is the reduction? So the reduction in pregnancy rates is almost by 64%. That is quite high. The live birth rate is also decreases by almost 67%. So that means women can have preterm labors. That is, the baby can be born prematurely, the weight of the baby can be compromised. Sometimes abortions do happen with large fibroids. There can be degenerations of the fibroid during pregnancy, causing severe pain during pregnancy, which has to be treated accordingly. The other thing is, very rarely, if there are large subserous, those are fibroids on the outer layer of the muscle or on the outer layer of the uterus wall, sometimes twist and turn, causing severe pain, requiring an emergency surgery while the woman is still pregnant. Now, how do we know? How do we diagnose a fibroid and how do we treat a fibroid? The first way to diagnose a fibroid is by asking the history. When a woman approaches a hospital with a problem, that means she is symptomatic or she does have a problem. Or sometimes you may undergo an ultrasound as a routine test as a part of a health checkup and you may come across these fibroids. So that is how you come to know that you have fibroids. So a clinical history, completely tell your history to the doctor, understand what is a normal menstrual cycle, so then it is easier to understand what is a heavy menstrual cycle. Let me tell you a very surprising fact. Many times we do find women who come to us and we ask them their hemoglobins with 3 grams of hemoglobin, 4 grams hemoglobin, very commonly 8-9 grams hemoglobin. And we ask them, how was your period? Oh, it's very normal. I just bleed 1 or 2 day heavy. And then we go into the history and ask them with a calendar. We show them what is a normal menstrual flow and what is an abnormal flow. And they're like, I've always had a heavy flow. So we find that many women are used to living with heavy menstrual flow, thinking that it's absolutely normal. Let me tell you, it is not normal. If you have a very heavy menstrual flow, which is causing you to be fatigued, with low energy levels, unable to do your work, you're getting spells of syncopal attacks, or you're not able to concentrate, you're not able to do any exercise, you're not able to look after your family, look after yourself, then it is a problem and you need to go and see a doctor to treat these fibroids. So fibroids can be diagnosed by an ultrasound. First is a clinical history, clinical examination, and an ultrasound. Sometimes we also do an MRI in certain indicated cases. So how do we treat fibroids? Well, fibroids which are away from the cavity, from the endometrial cavity, like this endometrial cavity, and they're away and they're small, usually don't need much if they are just discovered accidentally or incidentally while performing a routine ultrasound for some other reason. You don't really need to do much about it. But if they're causing trouble, they're causing pain, and if they're very large, which is literally pushing and causing problem while you're passing your bowel or passing urine, then yes, they need to be operated. They need to be removed. And if they're causing heavy bleeding, like inside the lining of the uterus, and they're causing infertility, that is, they're not allowing you to get pregnant, then you have to remove them, and that is removed by surgery. What type of surgery? They can be removed by hysteroscopy, that is passing a small telescope inside the womb, and a fibroid can be removed. The second way is laparoscopy, that is putting a small scope or a telescope into the abdominal cavity, making through small holes, and you look into the cavity, and that is how it can be operated and can be removed. Also, robotic is another option. These are the methods to perform a myomectomy, which is the procedure to remove the fibroids. It is safe. In today's time, the complication rates are almost minimum or very few if done by an expert surgeon, laparoscopic myomectomy or a robotic myomectomy or a hysteroscopic myomectomy. Keep in mind that if you're feeling anemic, if you're feeling with low energy levels, fatigued, unable to carry out your daily activities, look after your family, look after yourself, then it's very important that you go and check yourself, to go and get yourself examined, go and meet your doctor. So it's very important to take care of yourself. So do not ignore, take care for a better life, for a good quality of life. Thank you.